Give us our overview. Set the mood. Nice.
Afternoon, Madam Chair, members of the committee. My name is Matthew Moore with Legislative Research, here to provide you an overview with the budgets for the state institutions for intellectual disabilities. Before you should be a copy of my budget analyses. It covers both Kansas Neurological Institute, or KNI, here in town, and Parsons State Hospital and Training Centers in Parsons, Kansas, where there's information pertinent to one or the other. It's hopefully been highlighted, and if there's any difference, I'll specify. What I would like to point out to members of the committee is in the copies I've provided you on page 14 through 17 are pink pages. Those are it's the budget for KNI, and then 18 through 21 is in kind of a slate gray, and those are going to be the budgets specifically for Parsons. So I just wanted to highlight that out. But I'll begin with on page 1. Last year, the legislature approved $57.4 million, including $23.3 million SGF for the IDD institutions. That's $26 million, $10.2 million SGF for KNI, and $30.8 million, $13.1 SGF for Parsons. Moving to page 2, right underneath figure number 2 there at the top, you'll see that the agencies requested a revised estimate of $60.5 million, and including $23.5 million SGF. This is an increase of $3.1 million SGF total above what was approved by the legislature. If you'll notice in that figure at the top, the SGF stays the same between what was requested and what the legislature approved. The only funds that changed were all other funds, and I'll explain that a little bit in a moment. The 3 sort of major items I'd like to highlight that are included in the revised estimate are salary increases that are associated with executive directives. These are Executive Directives 21, 53.7, and 21.538 that occurred in July and August. If you recall, last year, the agencies in their budget requested some funding for salary increases for their mental health / developmental disability technicians. These are the individuals that work on a daily basis with the residents at the state hospitals. While that didn't ultimately make it into the budget, these are those increases. The governor subsequently, during the summer, made executive directives to provide those increases. What I would like to make sure to highlight is these increases are not the 24/7 pay plan increases associated with facilities that serve individuals for 24/7, so corrections in the hospitals as well. Those funds for the hospitals generally will appear in KDAT's budget. These salary increases are more akin to what was requested last year, just to raise the starting salary for those direct care support workers. For 22, KNI was able to find some federal funds that had rolled over from the previous year due to that the temporary increase in the FMAP. Originally, when the agency had budgeted last year, there was an end date for that FMAP that got extended, and so those funds, having been extended into fiscal year 22, and then subsequently it's been extended as well, has freed up some federal funds that it intends to use to cover the costs of those executive directives. Parsons was able to find some savings in staff vacancies and shrinkage that allowed them to cover those costs in FY22. On page 2, yes, that's that first bullet. The other 2 items I'd just like to touch upon for 22 is that middle bullet, contractual nursing staff. KNI had included in its budget a little bit of an increase for contractual service nursing staff. So you might remember historically, whenever the agencies has vacancies and aren't able to cover shifts, they go to contractual nursing staff to cover those and provide support for the hospitals. And so in its budget submission, it increased the expenditures for those contractual nursing staff. The last bullet there for 22, as for Parsons, there was a kind of a general increase in supplies for the state hospital, just the agency adjusting its budget based off of the current costs that it's seeing for supplies and food contracts. You can see there at the bottom of page 2, the governor recommends $60.5 million for expenditures in 22. This is a decrease of $1,500 SGF. This is due to the governor not including part of a supplemental in her budget. I'll get into that in a little bit, but that would cover fiscal year 22. For 23, you can see there on page 3, the agency requested $61 million, including $31.7 million SGF. You can see not really a giant increase over FY22. The only two things I'd really like to highlight for that is those salary increases with the executive directives are continuing into 23. However, for 23, the agencies requested supplementals or enhancements to provide for those with state general funds. And the other point I'd like to highlight is that decrease in Title 19 funding. And so, as I indicated, due to the pandemic, the state receives an increase in its FMAP rate of 6.2%. As the pandemic continues, that 6.2% keeps getting extended. However, when the agency submitted its budget, the understanding would be for fiscal year 23, that FMAP would be, that increase would not continue, and so we'd be back to the sort of the normal distribution for what the federal government provides to what the state provides. And so that's where you see, particularly in that figure number 3, as kind of a jump in the SGF and sort of a decrease in all other funds is due to that sort of kind of returning back to normal, as well as those increases to continue those salary increases into 23.
Thank you, Madam Chair. On this decrease in the Title 19 funding, I know that you made the comment about that this date kind of has been moving. So there's a potential that that could get extended out again. And so we could have that opportunity to make a change in the future.
So, Madam Chair, members of the committee, if you're on that last bullet, there's that indication that originally that declaration was to end in January, which would decrease that FMAP for March of 22. That declaration's been extended. I believe it's supposed to end now in about April, I believe. So that would continue through the end of the fiscal year for 22. However, should that be continued again, you would be correct that there's the potential for that to be pushed into 23 and until that public health emergency is declared ended. So I would just then note on page 4, you can see sort of a breakdown of the categories of expenditures between the hospitals, as well as the sort of a 10-year history of state general fund expenditures. And you can see 23, there is that giant leap in SGF due again to those two items that I mentioned before. On page 5, I'd just like to highlight the agency's fee funds. So you have a graph there for K&I and a graph there for Parsons. What I would like to highlight is traditionally you might think of a fee fund as an agency maybe charging a fee for a license or a service that they provide. These fee funds are more recoupments that the agencies receive through private insurance, maybe some Medicare payments. So they've historically considered them not a steady source of income, but they are there for your information. Page 6 and 7 is just a little bit more in-depth analysis on 2022. Then page 8 is a little bit of the change from the actuals for 22. And page 9 is just a little bit more in-depth analysis on 23. I just would like to note on page 11, the supplemental Parsons requested both a supplemental in 2021, 2022, and an enhancement in 2023 for a crisis stabilization unit. In 22, there was that 15,000 that they had requested sort of for startup costs to begin creation of that unit. That wasn't included in the governor's recommendation. That was that $15,000 decrease I mentioned earlier. In 23, they did request about almost $650,000 for staffing of that unit, which was included in the governor's recommendation. And then I would just note on page 12 is the salary increases related to those 2 executive directives to increase the salaries for the MHDDT techs. You can see, again, in 22, those were covered by the agency in various manners, and in 23, they did include those for SGF, and the governor included those in her budget. The remaining analysis is just sort of those breakdowns of the hospitals individually. But with that, I would stand for any questions.
Any questions for Matthew at this time? All right, do we want to, Secretary Howard, do you want to do these one at a time? You want us to go ahead and go through all these, K&I, et cetera, and then come? Okay, so. Go through all of them, right? You're going to go through everything with yours. You're going to go through all of them with yours. Okay. So let's just continue.
So as I noted earlier, page 14 is just the specific pages on K&I. I don't really have any specific items to highlight. I'll note on page 17, you can see that sort of category of expenditures chart specifically for K&I. As I mentioned earlier, there is that increase associated for the executive directives that occur in 22 that's covered by federal funds. And then in 23, you can see the increase for those salaries that then is covered by SGF. And then on page 18, Parsons, you can see, again, there's some statistics in terms of the census, some performance measures, and a little just kind of notes there. And then 21 is that same expenditures graph. And as I indicated, there was the supplemental in 22 for the behavioral stabilization unit that wasn't included in the governor's recommendation. And then in 23, there's that increase associated both for that stabilization unit as well as the executive directives that were included in our SGF.
Okay. Questions for Matthew? Senator Petty.
Matthew, are you aware under K&I, I was noticing the bed capacity, and so have they been impacted by COVID?
I believe they have. I know that there is a little bit of a description in the agency's testimony about the impact on COVID, so I would probably defer more to the agency to describe what that impact was.
Okay, thank you.
All right. Thank you, Matthew. Next, we'll have Secretary Laura Howard, State Intellectual Disability Hospitals.
My team that's here,
Okay.
Senator, and then hand the presentation off. Laura Howard, Secretary for KDADS. Pleased to be here with Deputy Secretary Scott Bruner, our Deputy Secretary for Facilities and Hospitals. We also have with us here today two of our superintendents, Mike Dixon from Parsons State Hospital, who's also our State Hospital Commissioner. And then we're pleased to have Barney Hubert with us here, who is our interim superintendent at K&I. You might recall Brent Whittick was the superintendent for the last few years. He recently retired, and Barney came back. Some of you may remember him when he was our superintendent back. He retired in 2013, so we've been pleased to have him back for the last few months while we've been in a search process for K&I. So again, I'll hand this off to Scott to kick off the testimony, if that's all right with you, Senator.
All right, thank you.
Thank you.
Welcome, Scott.
Thank you, Senator, members of the committee. I won't belabor too much. Matt did a good job going through the budget overview and hit several of the points. We have some testimony that looks like this that hopefully you have. We won't read you every slide. That's at least our goal. But I did want to highlight a couple of things from kind of an overview perspective. My name's Scott Bruner. I should have started with that. I'm the Deputy Secretary, and I work with all four of the state hospitals. We've tried to provide some consistency in the presentation, and so you'll see similar information about our two hospitals for people with intellectual and developmental disabilities, and also on the mental health side. In the slide presentation, the first couple of slides just talk about the purpose and mission of Parsons and K&I and the role that they play in serving people with intellectual and developmental disabilities. They are different hospitals. The populations are a little different, but the superintendents will talk about that. On slide number 4, we tried to just give you a high-level view of the number of budgeted beds in each facility, and then what our average census has been through the fiscal year to date through the first part of January. And I think to Senator Petty's point, the numbers are down a little bit from our budgeted capacity. We've trended below the full budgeted capacity, but we are and have had some impacts from COVID where we've lost some individuals, or people have moved out, but the superintendents can talk more about that with more specificity. And then we have the number of positions there, which is important, and Matt talked about what's included in the governor's budget to address the pay rates for our direct care staff, the MHDD techs that do the work on the line, activity specialists, safety and security, folks like that. On the next slide is the turnover rate and vacancy rates for both hospitals. And that's also through January of this year, starting in the beginning of the fiscal year. K&I's turnover rate's about 38%, and Parsons is 22, a little over 22.5%. Those are higher than they have been, but not terribly out of range. And our vacancy rate currently for positions is about 20% at K&I and 21% at Parsons. We do think the pay rates are part of that, and addressing those through the executive directives that Matt talked about, the 24/7 pay plan, and some other things that are in the governor's budget will move us in the right direction. We haven't seen a huge impact from those things. We started the executive directive pay plans in June or July, so we're a little bit further into that. The 24/7 pay plan is a little bit newer, but we can talk some more about the impact of that. The next couple of slides just summarize the budget and the major funding sources. I won't belabor those points. I may then turn you next to slide number 9. What I did want to do was talk a little bit about what's in the governor's budget for the state hospitals and how that's important. The direct care salary increase that Matt mentioned with the executive directives, we are funding that internally for 2022, and the governor's included the funding to continue those pay rates through 2023. The basics of it is this brought all the starting pay rates for MHDDs up to $16.16 an hour, which is now consistent across all 4 of our campuses, and you can see the dollar impact there for each of the hospitals for 2023. There's also a 5% base pay raise in the governor's budget for 2023. That money shows up in the KDAD's budget, or it's in a central place, and then we'll distribute it to the hospitals if that's approved. And we think both of those things will help with retention and recruiting, because those are 2 things that will last through the base budget. On the next slide is the 24/7 pay plan, which is more of a emergency-driven adjustment. There is a base pay increase in that 24/7 pay plan for nursing staff. that applied to corrections in our state hospitals and the state veterans homes. And then there are some different differential pay rates, the hourly additions to the hourly pay rate that impact other employees on the campus. The governor's budget funds, those are all funded with Spark money for the remainder of 2022, and the governor's budget has funding included to carry those through 2023. The hourly differentials that are in here, those would stop at the end of 2023 with that funding, but the base pay for nurses would continue on. The next slide shows, if you haven't seen this slide before, is the different differentials and tiers and who it applies to. Happy to answer questions about that if you have them. At this point, I'll be here for questions, or happy to take some now if that's appropriate, Madam Chair, or I'll turn it over to Superintendent Hubert to talk about, give you a couple of high points about K&I over the last year.
Questions for Scott? All right, let's continue.
Okay, thanks.
Good afternoon. I am back. I'm Barney Hubert. I'm interim superintendent at Kansas Neurological Institute. I'm pleased to be with you today. The slides that I have that we prepared for you, the first one talks about our mission at KNI, which at its simplest is to support each person to have a meaningful life. There's things that we need to do to accomplish that, and really what we want is, despite the disabilities that people have, we want them to be involved in the community, to have relationships, to make choices, to be recognized as individuals, and at the same time ensuring their well-being. The second slide, number 14, we do have a current census of 129. Made a decision today, we're going to be admitting another person in 2 weeks. They live in 20 homes, so typically 6 to 8 people per home. Almost all of those people are classified as being in the severe and profound range of intellectual disability, and most have a variety of co-occurring disabilities. And the other thing that's listed on here is that KNI is really home to the folks who live there. Many people have lived there for over 50 years. You have that breakdown, but at the same time, we've admitted 43 people over the last decade, so typically about 5 folks a year. I think in 2021, we admitted 7 people. The next slide talks about some of the co-occurring disabilities that people have and the needs that they have. So really people that have a tremendous need for support just to get out of bed in the morning. About a third of the folks receive their nutrition via tubes. Another third need modified diets to eat. Many have cerebral palsy, seizure disorders. Majority use wheelchairs. Most need toileting support, so very severe disabilities. Slide 16 just indicates that we've tested over 8,000 times for COVID, and we have had particularly, and slide 17 goes into our COVID response a little more, we've had an uptick in positive cases with the advent of the Omicron variant, but that is now on a downward trend. But the thing that we're most proud of is that no one living at KNI, despite the severe disabilities they have, has passed away as a result of COVID. And I think we attribute that to the fact that almost all are vaccinated, almost all are boosted, and oftentimes people, when they've tested positive for COVID, have either had mild symptoms or even been asymptomatic. Slide 18 talks about some of the things that we're proud of over the last year, and certainly the COVID response is one of those things. We've admitted 7 people, and those admissions have been successful. Guardians, we survey guardians every year, and they are extremely satisfied with the services provided there. We've streamlined training because some of the in-person training was difficult to provide during COVID, and we've continued some of our community outreach and special events. Our initiatives that we want to focus on going forward are, certainly this ties in with the staffing challenges. Our turnover among those direct support positions in the last year was roughly 50%. And at one point, the vacancy rate in those positions was 30%. And with the increase in salary that was provided, that Scott talked about, that is now down to 23%. And we're gradually stabilizing that workforce as well as our nursing workforce, which is very important to us. So we want to, some of those things, our focus has been on keeping people safe and healthy during the pandemic, but we really want to get back to achieving those other aspects of our mission. And so providing training to some of the staff we brought into during that time to make that happen. We also want to resume some of the outreach services that we provide in the area of assistive technology and some healthcare and things like that. And also our community partnerships, which are sort of listed, some of the organizations that we're connected with on slide 21. Scott talked about the changes in budget, slide 22, so I won't go into that anymore. And again, the big thing is the direct support salary increase for those mental health and developmental disability technicians and for nurses, because that's really the backbone of our workforce, and those are the folks that really make a difference for the people we support. And with that, I will stand for questions or turn it over to Mike Dixon to talk about Parsons.
Thanks so much for being here. And I just wanted to make sure I heard this correctly. When you were talking about it on slide 19, about that you've had in the past a 50% turnover, and now it's at 20%, is that?
No, the turnover among those direct support professionals, when I was superintendent years ago, typically would be in the 13 to 23% range, but last year it was 50%. Our vacancy rate at one point, it was prior to my arrival back there, was up to 30%. But with the increases in salary, we've been able to get that down to 23%.
Okay.
Okay?
That's just what I want to clarify. Thanks so much.
Okay. Other questions? Okay, thank you.
Thank you, Madam Chair, committee members. I'm Mike Dixon. I'm the superintendent at Parsons State Hospital and the State Hospital Commissioner. You will see me again tomorrow. I'm also acting superintendent right now at Osawatomie. So, the first several slides just really looks at our population at Parsons, and we are different from KNI. The main point being our individuals have more behavioral issues usually than what's admitted to KNI. We currently have 145 people, and they range in age from 12 to 21. Last year, we were able to discharge 15 people and admit 9. The year before was a little less than that due to COVID. We have a pretty equal split across the different levels of intellectual disability. About 40% are in the severe range, 34 moderate, and about 30% in the mild range of IDD. Approximately 30% of our individuals require intensive specialized medical care. The next slide, slide 26, just looks at our admits and discharges over time. Slide 27, the percentage of our individuals with the dual diagnosis currently and the percentage of our individuals with a serious mental health condition is in the 80%, 89%, and 82% respectively. Next slide, 28, 84% of our individuals engage in some type of physical aggression, 68% in property destruction, and 67% in self-injury. 4% or 6 of our 145 individuals right now require one-on-one supervision, which means that staff member has to be taken completely out of the count and they're assigned to one individual for the shift. 94% or 136 out of the 145 are on some level in the continuum of increased supervision, and 61% of our population require their own room.
own room, they're capable of being in their own room by themselves?
They have to due to behavioral issues. They either are really aggressive and we can't put them alone with somebody overnight, so 61%. Slide 30 looks at our percentage of admissions over time that had some type of police involvement. They're all pretty high numbers. 2021 was our lowest number in the last 5 or 6 years at 67%. We have continued to do business especially over the course of the last year. We've tried to get back to operations as normal. We still have the program that treats residents with a history of sexual offending. That's separate from we have a reintegration facility on campus also that's an offshoot of Larner. This is separate than that. These are actually Parsons State Hospital residents who come in and we provide them treatment for sexual offending. We're still doing our outreach services, which I'll talk a little bit more in a minute. We still have our assistive technology department, which serves not just our individuals at Parsons, but all of Southeast Kansas. And then, as I said, the transition cottage for people coming out of SPTP at LSH. We did.
Already been to Larned.
Yes.
Going there to continue their.
Yeah, they've completed the program at LSH and now they're transitioning into the community. Parsons has one of the 3 reintegration facilities in Kansas. The other one, we have one on campus at LSH and then we have one on campus at Osawatomie.
What percent of your population is that?
It's really low. We currently have 8. I believe we currently have 8, Melanie? Yeah, we currently have 8 individuals there. The progress review panel, which advances them to the reintegration facilities, they are meeting today, and there are 3 on the list today that possibly could advance to one of the reintegration facilities. So I'll have more information tomorrow on that.
They always have to go through you, or do some of them ever go back into the community from Larned?
Well, sometimes they can sue their way out, but they can only sue their way to a reintegration facility. So there are times when there's people in the program at LSH that the treatment team does not believe is ready to advance, and the judge will order them on transitional release. So then we place them at a reintegration facility and we watch them extremely carefully. As you can imagine, those people don't do very well. A lot of times we have to roll them back to the inpatient program because they're breaking rules and they're being risky. It still takes a judge's order, though, to keep them there. If the judge disagrees with us rolling them back, we have to put them back in transition.
So are you the reintegration facility, or what other types are there?
There's just the 2. There's reintegration facilities, that's it. There's the inpatient at LSH, and there's 3 separate reintegration facilities. Does that make sense?
More than at Parsons?
Yeah, there's a reintegration facility at Osawatomie, and there's a reintegration facility at LSH on campus. Okay. It's really just steps in the program.
Okay, it's still at the same 2 places.
Yes.
Thank you.
We did have a couple systemic changes at Parsons over the last year. We wanted to move away from crisis intervention training. It was really our restraint training if our individuals got aggressive. And we adopted nonviolent crisis intervention with advanced physical skills. It was really a huge endeavor. We trained 10 staff, and we were training so many staff that they actually came to Parsons to do the training. And we just finished, we started the training, our new staff in July, and we just finished in January getting all the staff trained over to the new philosophy. We also, at the same time, implemented trauma-informed care at Parsons. (33) is the performance-based budgeting results. 34 is just some additional programs that we have at Parsons. We have a KU is on site and they provide respite services. They have a payee program, the CRRS program. They do an equipment exchange. They help people with communications with their family. 35 is our outreach services. That really last year got up going again. They saw 131 individuals in 33 different communities. That really did slow down the year before in 20 due to the high rates of COVID. 36 and 37 are the different vocational sites that we have on campus for our individuals. 38 is we have a really active adult self-advocacy group on campus, and they're involved in a lot of different fundraisers. We did switch our new staff training in the last year. We went from a 2-day to a 5-day and then a 2-week additional course for them. And then on slide 41 are our numbers. Unfortunately, we did have one staff death due to COVID, and we did lose one resident due to COVID. It's odd that our worst month of COVID was last month. We had 72 staff at Parsons test positive during the month of January. And continually, we had multiple residents positive. Our isolation unit was open. Most of our cottages were quarantined. Luckily, we do believe it was the Omicron variant. Luckily, nobody got very ill. So, and we're still fighting it today. We have 25 staff today, and I believe 9 patient or residents still positive. With that, I will stand for questions.
Questions for Mike? Senator Petty.
I was just looking back at the slide about stand. And so this is made up of residents?
Yes.
And so are they, I guess I didn't read all the way through, are they self-selected or?
Everybody on campus can be a part of STAND, but they have officers, so they elect each other to president, vice president, secretary, treasurer. They have committee chairs, like social committees where they throw parties and where they raise money for different events in town. But yeah, they elect each other, but all residents on campus can be members of it.
And do you see that there's an interest and involvement in that?
Oh, yes. Yeah, they're very involved in it. And it's not just raising, they advocate for lots of different things on campus. We had a big school bus that said Parsons State Hospital and Training Center across it. The STAND committee advocated to get that removed from it because they didn't want to be identified in the community. They're extremely active. They sit on interview committees when we hire staff. We have a member of them in our staff training department that helps train staff. They're just a part of our everyday culture at Parsons. They push the services. So.
And I was just noticing when I was looking over the information, the budget analysis that had been provided for us in the section about aggressive and sexual behavior. And so it mentioned in there that you have seen a decrease, a decrease in the age of the persons coming into Parsons with aggressive sexual behavior. Is that, it says an average of 17 years of age. Is that it?
What page are you on? Are you in the budget narrative?
I'm sorry, I'm on the budget analysis. It was just saying that while the agency indicated that the overall population is aging, since FY 2019, its new admissions have been on average 17 years of age.
Yes, that's overall, our new admissions have been much younger over the last year, in 2 years than what we normally get.
That's overall, not just in that.
That's overall, not just with sexual aggression, but just overall, our admissions have been younger.
Thank you.
All right, other questions for Mike at this time? All right, you'll be hanging around, right?
I will. I'll be here all week.
Next, we have John Kelly, the Kansas Neurological Institute Parent Guardian Group in person. Welcome back. Good to see you.
Thank you. Good afternoon, Chairman, Madam Chair McGuinn, and members of this subcommittee. I want to thank you today for the opportunity to testify on behalf of those who are unable to defend, advocate, or protect themselves. My name is Joan Kelly, and my husband and I, who's with me today, We've raised our grandson since he was 2 years of age. He's now 31. He continues to be afflicted with profound autism and is often a danger to himself and others. We raised him in our home for many years, and after experiencing numerous HCBS fragmented system failures, we requested and had to prove we had exhausted every community option before he was admitted to KNI, and he's lived successfully in the continuum of care at Kansas Neurological Institute since 2008. I just want to mention that I'm also very grateful to Secretary Howard that she understands the great need for the continuum of care in this state. I'm going to do my best to honor you today and keep my testimony to about 5 to 7 minutes. I hope you'll bear with me. But I think it has to be said that there's well-funded research projects that are happening across our country which have a lasting and profound impact on IDD public policy. And although they're widely respected, and many of those are presented here before legislators and different subcommittees, as well as Congress, that the so-called research data has created an alarming distortion of truth. And I know this because I'm not only vice president of our parent guardian group, but I also work with families across the nation in many states who recognize that that the continuum of care that's described to you today is under siege. So there's a number of states who've closed their hospitals. So today I would like to just bring to your attention one well-funded entity who claims that our loved ones are languishing at KNI, and I can assure you that my grandson, we visit him every other week, except for when there's COVID restrictions. He is not languishing at KNI. He is receiving the supports necessary for his safety and survival and dignity. The United Cerebral Palsy is a national organization, just one of many, well-funded, and they pride themselves in their annual report. It's called A Case for Inclusion. However, after careful study of my own due diligence, I have found that they carry tremendous falsehood in their yearly reports. One example, and I'll just give you a couple examples in other states, but in the state of Georgia, they rate as one of the top 10 states for inclusion policies. And yet the Department of Justice conducted protracted litigation in the state of Georgia for a number of years and forced the transfer of the most fragile citizens in Georgia into community settings. And there was an extensive investigation done, which I've included. I know you may or may not have time to read the report, but I had to include it so you can see what a terrible travesty it is to misrepresent the truth regarding our helpless individuals. Additionally, United Cerebral Palsy claims that the state of Massachusetts is one of the best states for inclusion policies, and yet I have here from the Department of Health and Human Services, from the Inspector General, this is at the federal level, that Massachusetts did not comply with federal or state requirements regarding critical incidents involving developmentally disabled Medicaid beneficiaries. In addition, after careful tax return research in the state of Massachusetts, it was revealed a few years ago that more than 550, and the reason why I'm sharing this is because you guys have a budget, you guys have a hard job. I get that. You have to decide where certain funds are going to go and where they're not going to go. But I don't know if anyone has looked at the state of Kansas, but 550 executives working for 250 state-funded corporate providers were receiving, their CEOs alone several years ago were siphoning off over $80 million. It's gone to over to $100 million in the state of Massachusetts. So my respectful question to this committee as you're deliberating on K&I, as I listen to testimonies of families struggling in the community system, I would respectfully ask that this and the larger bodies really look at how much in the state of Kansas is siphoned off into upper management salaries to lobbyists. Because if we are responsible as taxpayers for our money, I just would strongly and respectfully encourage you to consider those things and how money might be siphoned off where it really could help the families, not only at K&I, but in our communities. I will close today. I think you can tell I'm a very passionate person because my husband and I, as many other parents, we invested our entire lives, time and money, to care for some of the most challenging individuals who live here in Kansas. But I just want to ask ourselves, what's really most important? What I understand from people who understand legislative process better than I is that most of what I shared with you in some ways doesn't really matter. What matters is that if it's not in the current governor's budget recommendations, that this chamber, and please correct me if I'm wrong, but that this chamber will not fight. If it's not in the budget, they won't fight for those funds. And so I just would like to leave us with a question, what kind of a state are we? Where are we going? Where are we headed? And are we willing to go the extra mile and do whatever it takes as a Midwest, kind of, we can do it, we'll get her done kind of thing, if we will continue in that vein of thinking, no matter what the budget is, no matter what the fiscal, amounts that were presented to you today may fluctuate. Are we willing to go the extra mile for this population? Thank you so much for listening to me, and I'd be happy to answer any questions.
Thank you, Joan, for being here. I do have a question. I'm trying to, you talked about Georgia and then you talked about Massachusetts. And is that in here?
I did not include I would be happy to leave you with the Massachusetts documents. I didn't want to overwhelm you. I wanted to really respect y'all and not, I already attached testimony regarding gatekeeping policies from an individual here and the deaths in Georgia. Did you not receive those attachments?
I got looks like the girl's death.
501 year.
Yeah, I got that. I got all the back. But when you started referring, I see a little bit about Georgia, but then you talked about Massachusetts.
Yeah, and I would be happy to leave some sort of unofficial printouts.
We'll have copied for the committee, so. If you mention it, you have to give it to us.
Here's just a few pages
Okay.
from case for inclusion. Although these are several years old, their goal to close all institutions.
Okay, we'll have Matthew get that copied for us. Thank you. Any questions for Joan? Joan, I want to just say thank you for coming up here year after year and with a passionate heart. Thank you. And for those that aren't always able to protect and defend themselves. So thank you
so much.
Appreciate it. All right, committee members, that concludes our testimony for the day. I want to go over just a few things with the agency. I want to make sure I'm clear. Starting on page, and I don't know if you want to answer them, Scott. Yeah, you're handy there. So for 22, the governor recommends 60 million, which is 23 million. It's 15,000 SGF less because of the supplemental requests on the crisis stabilization.
Yes, Madam
So
Chair.
can you tell me why the governor didn't request that?
I can tell you why we included it. So at Parsons, as we kind of looked at the service system and trying to figure out where there were some gaps across the state, one issue that comes up quite frequently is there'll be an individual in the community that maybe gets involved with law enforcement or is in a hospital because their behaviors are out of control, and there's no appropriate institutional placement that we can get them into quickly. And so Interhab and some other partners that we've worked with on the KDAD side have been talking for a while about what kind of service could we develop that would fill in that gap between somebody who's living in the community and then that disrupts for some reason and then they need some more stabilized stabilized location for care. And as we looked at what was available, there wasn't a lot of choices. So we thought about what could Parsons do with some building that we have there, the model that they have for treatment and stabilization, and where that might fit into the system. So Superintendent Dixon and his team came up with this idea of a behavior crisis stabilization unit that could fill in that gap, literally for somebody who's in the IDD system and has a disruption in their life, or they get involved with law enforcement and they need a place to stabilize until they can get back to their community placement for whatever reason. So we came up with this idea. Mike figured out what the staffing would be and developed a budget for it. That's funded in 2023 for the full year. We thought if we had some startup money in 2022, we could get that going and be ready to go live closer to July 1 than September 1 or October 1. So we included that in the budget. In the budget request, it wasn't included in the governor's recommendation, but she did include the full year funding for 2023.
So maybe we can talk a little bit more about this tomorrow, but the crisis stabilization unit, I mean, that's something we've developed over time in the communities, correct?
In the mental health, behavioral health world, yes. What would be different about this is it would be focused on individuals who, they may have a mental health diagnosis, but they're primarily have an intellectual or developmental disability and need that level of support as well.
Okay, got it. Thank you. Senator Sollentrop.
Thank you, Madam Chair. You know, on your employment challenges, we in the private sector have those as well, but based on the occupancy of the hospital and what assistants and professionals you have, did those persons depart up and down the scale, age-wise or ability-wise or experience, or did you see a more particular category of turnover that you needed to, to replace?
I'd ask the superintendents to think about an answer to that as well. We did look at, as we were in discussions with the governor's office about the pay differential or the differential rates, if that was, we talked about what levers would we need to pull to keep and retain staff. Was it a sign-on bonus? Was it a performance bonus? Was it an hourly differential? We worked through a variety of those options. We did look at the data about length of tenure and to see kind of where the turnover was. Was it people that were with us for 0 to 6 months or 6 months to a year? And we pulled some of that data together, which I can't recall a whole lot of it right now, but there was a lot of turnover in shorter term employees at that MHGD direct care tech level. So we thought that's where pay was probably the driver, and raising the base rate would be one way to address that. But I think most of the turnover is probably in the MHGD tech world and nursing, where those are also pretty competitive environments to recruit in any kind of healthcare setting where they've got some healthcare skills. I don't know.
We just couldn't compete. K&I and Parsons, prior to the executive directive, we were at $12.34 an hour. We're now at $16.16. In the exit interviews that we would do, we were losing people to Sonic, to Walmart. The pay was at least competitive because, you know, these are really, really hard jobs. So since that executive directive, that it went into effect, I believe, August, we have had a shift in our MHDDT leaving. You know, as Barney said, our vacancy rates at both Parsons and K&I has dropped considerably since that race. So we don't have that turnover. So it's going to be really interesting a year from now, looking back and getting the exact data that you're talking about. What age group are we talking about? Because Deputy Bruner's correct. It was our younger folks that we were just hemorrhaging. You know, they'd come in, they'd go through the training at the hospitals. They'd say, this isn't for me. I can make this much money at Sonic. That's where I'm going to go. We don't seem to have that near as much any longer.
Madam Chair, if I may, again, I was talking to the Secretary beginning before the meeting, and I wanted to get a better handle of some of those problems because we realize the challenges you've got, not just in your hospitals, but in the Department of Corrections and every agency we've got here in the state. So if you can supply any supplemental information to that effect, it'd be helpful. Yeah. Thank you.
Okay. Continuing on then. So note 130. Okay, that's fine. I'm just checking what they're asking for. I'm not doing anything otherwise. So then on 23, the governor concurs. So that's the enhancement to the salary increases through the executive directive. And then the decrease in the Title 12 funding due to COVID. That's the FMAP decrease. Okay.
As that rolls off in 2023 at some point.
Right,
Budget
April.
reflects that.
April, I was listening.
I'm optimistic that we might get extended, but it'll be in 2023 at some point.
I just want to make sure we know before we leave here what it is that you want and didn't get and that kind of thing. So K&I was the stabilization and the increases in pay. Parsons State Hospital Training Center. Governor recommends. Looks like the governor recommended that. That's
The
correct?
stabilization unit, yes, for full funding for 2023, the 24/7 pay plan through 2023, continued funding for the pay adjustments related to the executive directives and the 5%.
Okay, so what's the training center?
That's just in the training center part is in the title of Parsons State Hospital. The training center is the role we have with KU as a training campus for other professionals. That's not new. That's been in the mission.
Okay. I think that is it. $13 FTE. So what is on page 11 of our supplemental? Okay, so that's the crisis stabilization. So that's all tied together with the 13 FTEs? Okay,
Yes,
okay.
that's what we requested, yes, was 13 positions and $644,000 SGF.
So it's really, it looks like mostly everything is the salary increases.
Yes.
Nothing else, no outsiders.
Other than the security behavior unit, which is a new programming, but everything else that's in the governor's budget is related to sustaining the pay increases. And then the 5% that she's recommended for all state employees would be in there as well.
On top of that.
On top of that, yes.
And then, Mike, I couldn't find it real quick. Somewhere in here, you talked a little bit about the police officers that you have to call to stabilize.
Yes. Slide 30.
So percentage of admissions. Okay, that's not having to call the police out. These are admissions because the police brought them to you.
Yeah, or they just had police involvement prior to their admission to Parsons.
Okay.
I can't think of the last time we had to call the police. I don't think we ever have for things that happen on the cottages.
You're able to handle it. Okay. All right, well, have to commend you on, both you and Kay and I, on, I guess, limiting the COVID situation in your facilities. And that's almost, I mean, you just don't see that in congregate living very much. So you did a good job there. Any other questions for the agency? Senator Petty?
I'll just follow up on the COVID. When you said last month was worst month, I bet there's be a lot of people that would agree about last month being the worst month for being exposed or being in contact with somebody after you finding out that they had COVID. So it seems like, yeah, this is a very aggressive variant.
It is. It is.
So I wanted to ask you about you share with us the systematic changes that you included. And so the nonviolent crisis intervention with advanced physical skills. I'm just curious, you must have made a decision to bring about this training because?
It's just a sign of the field has evolved when it comes to protective holds. You know, we don't even call them restraints now at Parsons. We call them safety holds. Up until this new training, we called them restraints. It's a whole different way to look at it. With the CPI, in our program that we had before there was a lot of upfront teaching the staff on what to do to prevent the restraint in the first place. Now with the safety holds, we have even more of the upfront. So it is a little bit of a philosophical change, and the holds are a little bit different. So prevents injury to staff and our residents.
Any other questions? I don't see any. Thank you all for being here and your presentation, and welcome back, Barney. And we deliberate when, Mike, Matthew? Thursday. Okay. All right, very good. We're adjourned.